So people, when they think about addiction, it's kind of like in its own column. When we don't kind of compare it to other diseases that people can have relapses, reoccurrence. To give you kind of a simple example, and I use this when I do groups, is let's say you have a person that's a diabetic and they're doing all the things that doctors told them to do with their blood sugar. They're watching their blood sugar, they're taking their medications, they're watching what they eat. So basically they have a whole plan of how they're treating the symptoms of their diabetes, mapped out, that they were given by the professionals that treat it. And what happens in that is, let's say you have a person that's diabetic and the holidays come up and they're eating a lot more foods like sugars and cookies and cakes and all these things and not taking care of themselves, they wind up in the hospital. Basically what happened was they had a relapse of their disease, their symptoms came back, and they had to go to the hospital and get regulated. Addiction is through the same lens, and actually relapse rates for addiction and diabetes are actually kind of similar. They're within the 40 to 60% range. It can happen. And what happens if we're diabetic? Simply, they stop doing the things that the doctors told them to do to treat the symptoms of their disease. Addiction works the same way, where a patient will learn doing their outpatient programming, doing Alcoholics Anonymous, Narcotics Anonymous, working a program the way it's supposed to be worked, 12-step spirituality, working with a sponsor. When we do these things, a person in recovery tends to continually get better. And many times with a relapse, just like a diabetic that went back to the hospital, a person comes back to a treatment center. And they always, I can say this with consistency, it's always kind of the same thing. They'll say, you know what, I was doing great, but I stopped talking to my sponsor. I stopped doing the outpatient. I didn't think I needed it. They stopped doing something. So you look at it through treating the disease. What is the solution? The solution is now looking, okay, you had a relapse. You stopped doing this, so as you go forward, we have to continue treating this disease and doing all the things that we were taught that treat the symptoms of it. So you can compare that to any other, but with disease of addiction, it sits in its own column sometimes, but when we look at it through that perspective, it kind of takes the shame out of it. It takes the emotion to say, this is a disease like any other, it's a disease of the brain. And doing these things is going to help treat you. But in both cases, there's no cure. There's no cure for diabetes. There's no cure for addiction, but you can treat the symptoms, and that's the key.